Hello, everyone. Today, I feel honored that I have two of the most brilliant IMGs I have ever encountered in my life. It's a power couple of Dr. Luck and Dr. Ahmed. Dr. Luck is a neurosurgery resident at University of Iowa, and this year, Dr. Ahmed, who is also his wife, has matched into ophthalmology at University of Iowa. Uh, Honestly, say I have been following the match since I applied first in 2015-16, and Dr. Ahmed is the second IMG I have ever heard of getting matched. And I'm not saying that IMGs have not matched, but I have not heard. And then in neurosurgery, I think other than a few people from Aga Khan, I personally don't know anyone from Pakistan that have matched. So I requested them, and I'm very, very grateful because it's a Saturday. Those who follow cricket, it's Pakistan versus New Zealand match going on. But yeah, so again, without further ado, I would like to welcome both of you, and I would please request you to introduce yourselves, and then we will begin with questioning. Thank you.
Yeah, thank you so much for having us here. It's great to be able to talk to you and share some of our experiences. As you mentioned, I graduated from King Edward Medical University in Pakistan from 2021. And then I came here to the US, did a couple of rotations, applied for a research position, and was a postdoc research assistant at the University of Iowa for the past year and a half now. And then I applied for the match this past cycle, and I matched into University of Iowa ophthalmology residency, and I will be starting this July.
Awesome. And Dr. Luck?
Yeah, like Noor mentioned, thank you for having us. I graduated from K in 2018, and then I did a couple sub-Is as a med student. I'd taken all my USMLE exams during my MBBS, so I started research right after graduation. I spent 2.5 years at Brigham in Boston, then did a 1 year of preclinical neurosurgery at Iowa, and then matched in Iowa for neurosurgery in 2022.
Okay, and you are a PGY two
Two.
now? Okay,
Yep.
excellent, excellent. Okay, so I will start with Dr. Luck. So you said that the sub-Is, do you mean electives, right?
Yep.
So were those electives in neurosurgery?
One of them was I so at that time I think Mayo Clinic and Cleveland Clinic were the only economical options, and they both
Mhm.
required step one. So I applied to only those, but Cleveland Clinic doesn't offer neurosurgery elective to international students, so I did a liver transplant elective there,
Okay,
but it was surgical, and then
okay, very good, very
surgery.
good. Okay,
So
and then the postdoc position, where did you do that?
that was in the Harvard system at the Brigham and Women's and
Wow.
Surgery at Boston. And
Okay,
then I kind of figured that out when I was doing my electives here through people I was working with. Um,
cool. Okay, and so then you said that after that postdoc, you did like a preclinical. Can you tell us a little bit about what's that?
so there are very few programs in the US that offer a non-accredited kind of like a prelim year, but that's only neurosurgery. So it's not an ACGM accredited. But it is a neurosurgery intern year. The catch in that is that because it's not regulated, it can be a bad situation to be in. So
Okay,
you have to look into the program that you're going for. And Iowa has a very good reputation for their preclinical
okay,
program because it's been
okay,
20 years and people have successfully matched who are now like program directors or even chairs at certain other institutions who were IMGs and did this. So
okay.
that's why I decided to move from Boston to Iowa, even though at
Mhm.
that time I didn't know where Iowa was.
That's interesting. And this reminds me of one of the Pakistani origin actors, Kumal Nanjiani, I think.
Yeah.
I think the first time he came here, his father is also actually a psychiatrist.
Uh-huh.
So the first time I think he came here, he was 16 or 17. So he also, I think, went into Iowa. And that's the same thing he
Yeah.
said that he did not know, especially at that time without any social media and stuff, that he had only seen Hollywood and stuff like that.
Yeah. Yeah.
So, Dr. Like, my question is, so that is like a paid position where you get paid like an intern?
Yeah. So
Okay.
Iowa pays you at the same level as they pay their PGY one.
Okay, and they sponsor a visa as well.
Yep. So Iowa, I think in university programs that I know of, it sponsors an H1.
Okay.
So I did my research on J1, then transitioned to H1.
Okay. So the procedure to get that preclinical, of
Mhm.
course, I'm assuming it would be competitive. Is it a little less competitive than getting into the residency itself?
So it is very competitive. Like the positions get filled about 2 days after the match is announced. Uh, and just because how competitive neurosurgery is, and then like the top candidates who don't match apply here, most of them are IMGs. Like in the past few years, we have had a couple of AMGs who had a bad luck and didn't match, so they did this too. But yeah, most of the people, like I applied there during the match cycle, and then I interviewed the evening of Monday, like Monday when the match results get announced. And then interviewed the same night. And then all the positions were filled within the next day.
Wow. So their match is starts with September as well, or it's separate?
So this is not as scheduled. Like most of the
Okay.
people just email the program director and the program coordinator either during the interview season or right after the match result is announced, and then they
Okay.
look at the applications and decide who to interview.
Okay. And does other specialties have that too?
I know in general surgery there's a prelim, but that's the ACGME accredited prelim.
Okay.
I think like ortho or any other specialties that I know of don't have this.
Okay. Understandable. All right. Now, I would assume a role of an aspiring applicant that wants to apply to ophthalmology and neurosurgery, and I would start asking you questions one by one, if that's okay with you.
Mhm.
Okay, so I'll start with Dr. Ahmed. So, Dr. Ahmed, what would be your advice for, let's say, a second, third year medical student, an
Mhm.
IMG, if she or he wants to pursue ophthalmology in USA? How should they, uh, how should they approach this?
Yeah. So it's a good question. If you're a second or third year, great that you started thinking about this early on. The way to approach it would be number one, like make the decision. So that's hard because ophthalmology is super competitive. A lot of people, yeah, almost everybody would tell you not to do that to yourself and just like go with a more safer route, which is perfectly fine. But I think start with identifying if this is something that's really important to you, because it's definitely going to be tough. I'm not saying it's impossible. I've done it. Other IMGs have done it. I've had amazing mentors who are IMGs who have told me that they've done it and other people have. So it's definitely not impossible, but it is very stressful. It's difficult. There is a lot that you have to do. So the first question is, do you think that it's so important to you that it's worth it to go through all of that? And for me, the answer was yes, but it wasn't an immediate answer for me. So initially, I knew I liked ophthalmology. I was discouraged by how difficult it is and how people were telling me to like not to do it. And as I mentioned, we were chatting earlier, like us, apart from us, everybody else was telling me to, not do that to myself and just go to a safer route. But I did try, like I did other electives, I did other observerships, and I realized that nothing really excited me as much as ophthalmology did. And I would not be happy unless I really, gave myself that chance. Whatever happens, I was okay with the outcome. I was like, okay, even if I don't end up matching, I still want to do my best, try my best, because I wouldn't forgive myself if I didn't, because of how much I loved ophthalmology as a field. So the first question is like, ask that for yourself. Do you think that this is something that really makes you happy and you're super passionate about it? And if the answer is yes, then it's definitely worth pursuing, and, be okay with the outcome of possibly not matching as well, just so that you are sort of in that mind state where you know you need to try your best, but you also know that it's a difficult path. And then once you've made that decision, I think the next good step would be start reaching out to people. And that's helpful because as an IMG, unless you're from an institution that has a history of people who have matched into a competitive specialty or ophthalmology in particular, there's not a lot of guidance. And then reaching out to people is the first step that you would need to do. And that's what helped me. I reached out to people who had matched into ophthalmology from Pakistan. There were people from Al Khan, and talking to them really helped frame my like structure what I needed to do next. And that was the overwhelming advice that I got was do observerships, apply for a research position, and basically get your foot in the door so that you're working in that system within ophthalmology so that people can know how you are as a person, what you're doing, and then it becomes easier for people to vouch for you when you're applying for the match because, they have a lot of competitive AMGs who are applying for the same position. And if they're taking somebody who's an IMG, it is a risk for the program, and they need to know it's like a safe risk. They don't want to, put themselves in a position where they match somebody they don't know enough. So you need to basically prove that, you're somebody who is worth taking for that program. And so that would be the next step. Try to reach out to people and sort of develop a framework of what you need to do next. And so these are the basic steps. Once you overcome these steps, I think you sort of find pathways. Once you get into the system, you find mentors, you work with them, you keep checking in with them for advice. You make sure that you're doing what they're saying, and then you're making sure that you're doing the best that you can. And that's sort of like after that, the pathway is very different for different people. So everybody would have a slightly different story. Some people would do like a year of research, 2 years, 3 years. Some people would maybe do their like pre-residency, like ocular pathology fellowships or stuff like that, that you could do. So it's very different. It really depends on what you're doing, what your CV looks like, and what your mentors are advising you to do. So that's basically
Uh, Dr. Luck, this question would be first from Dr. Luck and Dr. Ahmed. So, would you recommend doing, or at least trying to get an elective in neurosurgery and ophthalmology during med school? And if yes, again, you were sharing earlier some places. Would you recommend a few names so that people know?
I think yes, it helps. It's not necessary. Like when I was applying into the match the first time, I thought that because I have had electives, I have enough clinical experience, but that wasn't counted as enough for me. But what it helped me with was to see the lifestyle as a med student and then decide if I want to commit myself to this kind of lifestyle.
Mhm.
And second, get to know people. And though that helped me getting a research spot. Now, I've known people who matched without doing electives. You can just do straight research or the preclinical fellowship that, like, there is one resident in my program who didn't do research, just did 2.5 years of this preclinical thing.
Wow.
So there are different routes. I know there are people who do PhDs and then they apply.
Mhm.
Uh, so elective helps, uh, but I don't think it's necessary.
Do you know, so you mentioned, is it Mayo Clinic in Cleveland? They potentially offers a neurosurgery, it's the subject itself.
I know there are other places like Columbia, NYU, but that's like $4,000. So unless you have
Wow.
$1,000 lying around, you can.
Okay. And how much do these Cleveland and Mayo Clinic, how much do they charge?
When I applied, I think it was $500 each.
Okay. All
That
right. And they
is
do require step one, right?
yes.
Okay. All right. And Dr. Ahmed, what about ophthalmology electives?
So I personally did not do an ophthalmology elective because when I was a med student, COVID happened. And so the only open elective opportunity was the Mayo Clinic, and I applied for peds surgery because at that time I was also like trying to explore if I could possibly do something other than ophthalmology, like maybe general surgery, like, just like trying to make my life easier for myself. And so I went for a peds surgery elective. But I think it really helped me in my ophthalmology journey itself as well, because I mean, it's a surgical subspecialty. I got a really good evaluation from them, and that helped, also speak for my performance as a student within the US healthcare system, that I was able to like catch up quickly and, be useful in the OR and stuff like that really helps. And then after that, that was the only elective that I was able to do because of COVID. And then once I had graduated, I took step two and then came here for observerships. And so I did two observerships in medicine. One was in cardiology and one was in pulmonary and critical care. And then I did an ophthalmology observership at the University of Pittsburgh. And I think The reason that I did those medicine observerships was, again, I was still trying to, make sure that I needed, I wanted to make sure that ophthalmology was the one choice for me.
Yes.
Also, it helps to have that because the first year of ophthalmology is prelim. It's not a prelim year, but it's like a internal medicine year.
I
Um,
understand.
and
Okay.
sometimes programs do like to see letters from,
That's
medicine
interesting.
experiences. Not
Great.
all programs. It really depends. I think for an applicant, just try to reach out and see what each program prefers. Sometimes they do like to see medicine experiences, and I did use a letter from that in the ICU, the pulmonary critical care
This
experience.
UPMC place observership, is it like a formal one or you just reach out to people and
I just reached out to people. I had basically talked to other IMGs who had done these rotations, and I found out that UPMC is open to having observers. Tulane is, Cook County is, the University of Virginia is open to that. I haven't done experiences in those places. My only experience was at Pittsburgh, but these are the places that I've heard. It differs. So if you're applying or thinking of applying, definitely reach out to the people who are in the process, and they would have the most updated information about who's allowing observers or not. But I think that was super helpful. It also, as it said, helped me see the lifestyle of ophthalmology, and I realized by the end of it that this is something I really want to do. And so I think it was helpful.
okay. All right. Well, thanks for letting us know. Now, very quick, briefly, I will ask. So, impact of scores in neurosurgery and ophthalmology, Dr. Luck.
Mhm.
So you need as high as you can go. But mostly, like I had a 257 and 247, step one in CK.
Mhm.
And as long as it's above the threshold, which I think is 240 or 245,
Okay.
uh, that gets you through the door, and no one cares about your score after that in neurosurgery.
So scores, so though they don't play as much of a role as, let's say, in internal medicine.
Yeah, yeah.
Okay.
Yeah. I think I would say for a competitive field, aim for as high of a score as you can possibly get. Step one is now pass fail, so having a good step two score will definitely help. And then if you can take step three, I took step three before I started my research position because I had some time before, I got the position, but they were still processing my work visa and stuff. So I took step three. I got a good score. I think that was helpful for me. But then again, the reason that a score you need to get a good score, definitely get an above average, a nice score. But the reason that it's like less, less important, as you said, in internal medicines, but because by the time you're applying to a competitive specialty, you have so much more in your CV. You've done a research, you've done rotations, you have presentations and publications and awards and whatever stuff in your CV that a score is just a number at that point.
Yeah.
Versus while applying into internal medicine, you're just like applying straight after med school, not having done all of that. So the score is the most important
Yeah, and I
thing.
would say like by the time of your application, what's the most important thing is the person or your mentor that you've worked with. He
Yeah.
just picks up the phone and talks to the program director. That has more value
Oh,
because they
okay.
know each other.
Even
Most
to get interview or after interview?
after interview, I would say, or even
Okay.
before,
Okay.
uh, because his or her letter carries more weight than
Okay.
anything else in your
Makes
CV.
Yeah.
sense.
Because
And
that,
Dr. Luck, did you had you taken step three already when the cycle you matched?
yes. So
Okay.
I had to take step three before starting my preclinical year for the H1 visa made basically.
Oh, okay,
Uh,
okay.
and
Makes
I
sense.
wanted to get done with it. I didn't want to read about urinary incontinence and other stuff and
Okay.
neurosurgery.
Okay. Now, a lot of the question which a lot of people ask is, so usually for very comparative specialties, of course, like ophthalmology, uh, neurosurgery, plastic surgery, derma, orthopedic. I think for IMGs, what I have observed is that postdoc is like almost like a must. Now, have you encountered, I think Dr. Luck, you mentioned that there are some people who matched without a postdoc, but with like that preclinical year. Is that true?
Yeah. So there are basically three pathways that I have seen people get into
Mm.
neurosurgery. One is they come here, they do an additional degree. Most of the times it's a PhD.
Is it in neuroscience?
It can be anything,
Hmm.
but what basically helps is that you demonstrate that you have worked in this system,
Okay.
and then you're publishing and all those sort of
Okay.
things. And then the other pathway is doing a postdoc and applying and getting matched straight from the research.
Okay.
And the other is like a mixed pathway where you do some research, some clinical work, or either entirely clinical work. I think depends on the institution that you're working at. For example, where I was doing my research, they had a certain portfolio to maintain, so they didn't want to take an IMG.
Mhm.
Uh, but if you're working at an other institution that has a history of taking IMGs and they don't care where you're coming from, then just doing research might be enough. Uh, so I think it depends on each individual scenario.
Okay.
Yeah.
And Dr. Ahmed?
I would agree. It doesn't depend on individual scenarios. For ophthalmology, there isn't like a clinical ophthalmology year that you could do, unlike neurosurgery. So there are ocular pathology fellowships, but it's more like it's not as there might be some clinical experiences within it, but it's mostly a lot of research and pathology itself. That some programs offer that, people do that. But the most common, or I think everybody almost who I've talked to did something that was similar, like did research, did rotations, and then applied. And then, as it said, it really depends on your individual situation and what your mentors sort of are advising you to do.
Yeah.
So, because they would know what is lacking in your CV and what could be overcome by doing something else. So like some people would do an extra degree in ophthalmology, such as MPH before applying, but not everybody needs it. So your mentors would sort of direct you about how many more years of research do you need to do, or how many other rotations do you need, or do you need an additional degree or not? And it would differ based on the candidate that you are. So I guess the first step would be to get a research position and then go from there.
This ocular pathology, is it like an unaccredited fellowship that you can get even without doing any prior ACGME accredited residency or so stuff?
Yeah, it's something similar. Mostly, people tend to take people for that fellowship. I've mostly seen people who have done an ophthalmology residency in their home countries. They can come here and do that. There are also other fellowships that you can do after doing a residency in your home country that include like neuro-ophthalmology has spots, pediatric ophthalmology has spots. Sometimes people do that. Sometimes they don't even do a residency after doing those fellowships and just do like 2 or 3 fellowships, get a restricted license and practice. But then some people would do a few fellowships and then apply for a residency, repeat their residency, and then sort of go that route. So there
Right.
are several routes that you can go through depending on your individual situation. But the ocular pathology fellowship, some of them do take like med students or people that are fresh out of med school without having that previous experience. So I think it really depends on your individual circumstances. And obviously, as you're coming in, you're just trying to apply to everything and like emailing everybody and try to understand what exactly matches your portfolio best. So
So I actually recently did a podcast with one of my seniors. So it was like a relatively simple because he did like a nephrology fellowship, and then a lot of King Edward people have done that too, and then internal medicine.
yeah.
So basically, what you're saying is that let's say there is an ophthalmologist from Pakistan who have done MS or FCPS. Now,
Mhm.
in order for them to, let's say, get a neuro ophthalmology or any other ophthalmology fellowship, they would definitely need still like ECFMG certification, right?
Yeah.
Yeah.
Okay. Now, like nephrology, endo, they are at times not as competitive. Now, what about ophthalmology fellowships? Are they competitive and are they like, or they are easier to get like nephrology, endo, and rheumatology?
Yeah, I would say like some fellowships are super competitive. It's really hard to get into them, even if you've done a US residency. But then
Mhm.
some fellowships are less competitive, and there are spots left over. And those are the fellowships that usually people coming in, having done a residency in their home country, are more likely to get into. And so, as I mentioned, neuro-ophthalmology or peds ophthalmology are some of the fellowships that I've seen people do using that pathway.
That's very good to know because I remember at UND where I did my residency, in psych you have to do for neurology. So there was one actually neurologist there who was a neuro-ophthalmologist,
Mhm.
and he told me it's a very rare entity
It is,
that
yeah.
you will see a neuro-ophthalmologist.
Very
Interesting.
super specialized fields.
Okay. Now, I would start with Dr. Ahmed. So, Dr. Ahmed, when you applied, of course, knowing that ophthalmology is super competitive, how many programs did you apply to? How many would you recommend people applying to?
Yeah, so I think it really depends on your individual situation and check
Mm.
in with your mentors. Mostly people who are IMGs would apply to as many programs as possible. And so I think it really there's no set answer to that, and it really depends on your individual portfolio and what your mentors are applying to do. Sometimes might want to focus on some particular programs more versus others. And then also, as Asad said, there's sometimes you need to take into account of whether a program has a history of taking an IMG or
Oh,
not. That
okay.
personally for me, I did match into a program that did not have that history, but I'm not saying that it's impossible to do that. It's definitely possible, but I think it really depends on your individual
But I
circumstances and
think
checking
as
in with your
as
mentors.
an IMG, you should apply to all the programs.
And how many programs, any idea in ophthalmology in total and
Surgery,
neurosurgery?
there are 117 last year.
Okay, so yeah, that's not a lot as compared to
Yeah.
internal medicine where people
Yeah,
are applying to
people are not
200 and more.
about
Yeah.
200 or something.
Yeah.
Yeah.
Okay,
There are
understandable.
no community programs, I think, in neurosurgery and in op.
There are some
Yeah,
programs in
yeah,
ophthalmology, but
Yeah.
they're not as
So
many.
it's all
okay,
university programs. That's why.
understandable. Okay.
Yeah.
Now, again, roughly, it may not be an exact answer, that what, in your opinion, would be a safe, provided that the interviewing skills are reasonable enough, like a safe for internal medicine, people say if you have like 7, 8, 10 interviews, you will consider yourself a little bit safe. So in ophthalmology and neurosurgery, what would be uh, your
I think
recommendation?
your highest chance of matching is at the program where you're working at.
Okay.
But then the more number of interviews you have, that obviously raises your chances because, for example, if you're working in Iowa for ophthalmology, that's like the top program. But
Mm.
if you've done research there, then the lower tier and medium tier programs see you as a very uh, good candidate because they
Okay.
will get a bright candidate who would not match at a top program. So they would be more interested in you.
Oh,
So
interesting.
I think roughly the people that I know of all had 5 or 6 at least interviews. Like I had 7 the year I matched.
Okay,
Uh,
so 5, 5, and 6. Okay.
Roughly the same. But again, it's like there are some programs that just interview you because they're good friends with your mentor, and that's it's a uh,
It's a courtesy.
courtesy interview. But
Yeah.
then other programs who are struggling and they want someone who can work uh, and help them achieve their goal too. So they would be very interested.
Understandable. And Dr. Ahmed?
So in ophthalmology, there's a cap of 15 interviews. You can't accept more than 15. Um,
Oh,
so
okay.
so basically that's the highest that you can possibly go. But as Asad said, I've heard an average of around that same number of people who get. Again, there's no hard and fast rule. People have matched with less, have gone unmatched with more. So I think that's like a good rough estimate, but not an absolute hard and fast rule.
Okay. And if I may ask, by understanding, so I think both of you matched at your second time?
I matched my second time, Noor matched her first time.
It was
Okay.
my first time.
Yeah.
Okay. Wow. That's impressive. Okay. And the reason I was asking is because I myself matched at second time. And that is also something that, especially for super competitive specialties, that people struggle so much, especially after staying unmatched. So, Dr. Luck, how did you keep yourself motivated?
I think in competitive specialities, people appreciate your struggle.
Mhm.
So no one cared that I was applying the second time because they know it's hard for an IMG to match. So they appreciate that you're still going on.
Okay.
Uh, the first time after the match, like when I talked to my mentors at Brigham, they mentioned that you do need a clinic. The only thing that's lacking in your CV at this point is a good clinical experience. So Iowa
Uh,
seemed like the perfect option. So
okay.
that's why I came here. I kept myself motivated because there was just not enough time to think in my preclinical year. So you don't get too much time to think about stuff. And then the program at Iowa is very supportive. Like I didn't feel like there was a difference between me versus residents. You all get treated the same way. And then people appreciate your work ethic. They appreciate the work that you're doing, uh, and they support you. So, for example, when I applied, uh, like my residents vouched for me, who I
Wow.
and they
Wow.
went to the chair and the program director,
Yeah.
and they said that we need this guy. Uh,
Wow.
the same happened
That's big.
here too, where we had another preclinical fellow that we all liked, so we all went to the
Right.
leadership and
Yeah.
vouched. So
And I think that you make a really good point that in especially in US, I think a lot of time, and I may be wrong, that's my perspective, that in Asian countries, Pakistan, India, there's a lot of focus on excellence or brilliance. But I think in US, what I have personally also witnessed is that the hard work and professionalism,
yeah,
the attitude where you would want to learn
yeah,
and you don't come out as I know it all. So I think that is something which I have personally seen that they love. I mean, the commitment. I often quote example one of my friends who had relatively low scores and he really wanted to do surgery. He had some financial support from Pakistan, so he could. So he actually started from doing electives at University of Pennsylvania. He just stuck there. He was there day in, day out. And then he ended up getting a prelim. I think there's a 2 year prelim he did. He matched at categorical, was chief resident. Now he's doing cardiothoracic at John Hopkins. So
mhm,
I think that what I saw in him, I also he did house job with me as well.
mhm,
So I think that the role which he assumed even during the house job, the commitment, it was another level that
Yeah.
I could never do that. So I
yeah,
think that you make a really you made a very good point. I'll be very honest that I mean working like for 12, 14 hours straight, like doing all that, that takes a lot out of you. So
Yeah.
agree. So the next question is in different specialties, the role of interview itself is different. Like for psychiatry, sometimes neurology, they pay a lot of attention during the interview. In internal medicine, I have seen not that much. I mean, they look at you, but they are mainly filtering out any red flag. So, Dr. Ahmed, what's the scenario in ophthalmology?
Yeah, I think it depends on the program. What basically they want to see in a candidate. An interview is an important screening tool, as you said. It's very, if there's a red flag or something in the interview, you definitely are messing up your chances. But I think, as you said, it's a combination of things. So it's not only your CV, it's not only your interview, it's a combination of your CV, your interview, your letters, your mentors vouching for you, as it said, the program vouching for you. So for me, that was also true. I really wanted to stay at Iowa. It's like a top program. It's also the city where my husband is, and I did not want to do long distance. And
That's the
the
biggest
program,
motivation.
yeah. And I mean, I think it worked out for me that Asad matched at Iowa, that I got to work at such an amazing program for ophthalmology. So it was a combination of my mentors vouching for me, the residents vouching for me, having worked with in the department extensively. So the interview was definitely one factor, but it was all this history that I had before even I stepped into the interview. They had seen me working for a year. They had seen me, work in research, do clinical observerships, rotations, balance all of that, work with students, work with residents, and keep that balance, excelling, trying like doing my best to excel in each of these individual categories, but also like keeping in this open-minded approach of learning and trying to be better and trying to be open to feedback. So all of these things really help. So the interview is definitely important to nail it, do your best, go prepared, go in knowing the people who are interviewing you, look them up, definitely look up the program, talk to people beforehand. But it's also a combination of all of these things. It's not the one deciding factor that,
I think if a program really likes you, there is going to be a lot of back channel communication. Like
yeah.
if I have a friend in Boston and we're interviewing someone from Harvard,
Mm.
I'm gonna be reaching out to him and ask, okay, how is this guy?
Okay.
Yeah.
So the interview, I think, yeah, it's just a screening process, and especially in COVID, it's with virtual interviews, it's so tough to
Yeah,
say, I think.
absolutely, absolutely. So physician couples, especially like you, and you would be, of course, starting your residency now. Uh, how difficult is it just with being in such competitive fellowships that demand so much of time? How difficult has been for you, both of you, so far?
Not at all.
Okay, wow. That's a political answer or
Right. Yeah, I would say it really helps to have a partner who's just as passionate as you are about your career. And that's something that was really important for me, because people who know me know how important my career is to me, but how important family is to me at the same time. And I guess I found that in Asad. He's super passionate about his career, but family is just as important to him as well. And so I think that that's helpful. It is difficult. You're both busy. You're both like stressed out, freaking out, and you might be in that stressed situation at the same time and like not knowing how to communicate those feelings. Sort of end up having to navigate that. But I think it's really important to keep communicating, I guess, and like trying to understand where the other person is coming from. So yeah, that's
Yeah.
basically we're still navigating it. So I don't
Oh
know.
yeah, yeah, of course, of course. Yeah, no, and I hope that everything goes smoothly because I agree that again, being because my wife is also in the same field, so it helps a lot. I mean, especially
Yeah.
because my wife is the same field, that helps a lot. We discuss a lot of things, but more importantly, they understand. Let's say if you had a rough day, they
Yeah.
can actually empathize with you, put
Yeah.
him or herself in the same shoes. So I think that plays a huge role. Now, we will just wrap up the session. Any last minute advice from both of you, again, for medical students, for applicants, for aspirants, especially IMGs who want to pursue neurosurgery, ophthalmology, or any super competitive specialties? What would be your advice?
Um, I would say see what motivates you, and be okay trying and failing rather than just not trying. Because life, like if you imagine even wasting like a year or two in a 60 years or whatever the average lifespan is for Desi people,
It's probably less than
it's
60.
not that big of a deal. But
Mm.
again, saying that everyone's financial situation is different, visa situation is different. So you should start planning ahead. And it's always helpful to reach out to someone who has done this because it's not worth talking. If you're talking to someone whose only goal is applying to internal medicine, not that that's bad, he's not going to encourage you to go for a specialty that has a much less chance of success, even with a stellar CV. So you should talk to people who have done it and they know what they're talking about. And then they can guide you in each individual circumstances. Okay, this is what you should do, or they will connect you to someone who has. So for example, in Noor's case, she talked to people, and that they connected, like her mentors connected her to IMGs from Pakistan.
Wow.
So talking to people helps, uh, because like listening to these podcasts, I can tell you to do research, do this,
Mhm.
but there are like simple logistical questions. How do I get research?
Exactly, exactly.
Visa
No, yeah,
process.
no, I agree. I
Navigate the
totally
visa
agree.
process, or like I'm at this particular step.
Yeah.
What should I do next? So having someone who can guide you at every step of the way is helpful. And then every specialty has their own personality type. So, for example, if you are overly communicative in neurosurgery, that would not go very high towards you. Decision making is supported. But in ophthalmology, if you're being too independent, that might not be
No,
viewed as
ophthalmologists are
positive.
nice people who love to
So,
hang out with each other and are
so I think,
fun, have a life. So if that's you, then definitely.
so,
Interesting.
so I
Yeah.
think someone to talk to is helpful.
Okay. All right. And Dr. Ahmed.
Yeah, I would say the same. Somebody who's if you're at the stage where you're considering what you want to do is, try to identify what you're most passionate about. Because if this is something that drives you and you're passionate about, then it's not going to feel as difficult because you would be seeing the bigger picture. And then one thing that one of my mentors told me, was to not focus, like, try to focus on the big picture and kind of try to enjoy the journey, which is hard. I wasn't able to enjoy it as much. I was like stressed out most of the time, but I still enjoyed it. I loved it. I learned a lot. So try to focus on the big picture and your bigger goals, and not get caught up in the details too much, or caught up in the little stresses too much. But then also be really honest with yourself and see if this is something you want to do, and if there are gaps in your CV or your record or whatever. Like, be very honest with yourself and be honest with the people that you're reaching out to, so that you can see what you need to overcome in order to get to that point. And as Asad said, like, talk to the right people. Sometimes you have to have a network of mentors. You can't have like one mentor only, because everybody has a different story and a different perspective. Yeah. And it doesn't have to be like research mentors. It could be like clinical mentors, or like, people who are residents or attendings, whatever, at every different stage of life. And they would have a different perspective. They would have different advice. So you don't have to follow every advice that you get. You just follow the advice that feels closest to you and reflects who you are as a person. So that's also very important. Don't pretend to be somebody you're not, because that's like, people can see that. So try to follow the advice that resonates with you. You will get very different. So for example, I talked to some people who told me like, don't apply unless you've done like 3 years of research at least. But that wasn't my case, because the advice that resonated with me was from the mentors who had worked closely with me and were telling me to like, go ahead and apply. You don't need 100 years of research, because like, we know that you're ready. So you need to like really take the advice that is resonating with you, and then leave the rest. So that's important as a whole.
What I have seen over the past several years in which I have been involved with mentorship circle is that not a lot of people would give you an absolute honest advice. A lot of time, what I have seen is, and my own experience was back in the day, people would sugarcoat.
Yeah.
Because no one wants to be that bad guy who says
Yeah.
that don't do that.
Yeah.
Uh, and I have had some bitter experiences where I have told people that, like before applying, that it doesn't look like a strong enough CV. You could do this. Uh, and sometimes, I mean, they don't like it. I mean, they say, "Oh yeah, he has done himself, so he's arrogant." But
Yeah.
when I stayed unmatched for the first time, and I'm of course not blaming the people who advised me, but I felt that if I had like more honest advice and recommendation from the people I talked to, things may have been different. So I think that is very important. You make really good point that you can have uh, recommendation advices from different people. So go with what resonates with you, because everyone has different perspective. And at the end of the day, you need to do what you need to do.
Yeah, there's a lot of self-evaluation also
Mm,
required in the process. It's not just like blindly working hard
mm.
and stuff. You also have to be very, evaluate yourself and be smart about everything you're doing, and, make sure that it's in line with the bigger goals that you have in life.
Absolutely. Okay. Well, thanks a lot, Dr. Ahmed and Dr. Luck, for joining me on a Saturday. I'm sure that anyone who sees this would definitely get motivation, and also would learn a thing or two in particular for plastic surgery and ophthalmology. Have a good rest of your day.
Thank you.
Thank you so